Hello. Today I'll be talking about some similarities and differences in existential and Gestalt therapy. So, the strengths of existential therapy is that it does a good job at addressing death and may be indicated for elderly, terminal patients, or families who are facing death or palliative care. Focus deeply on respecting the individual, existential meaning, self awareness, freedom, and responsibility. An honest and two-way therapeutic alliance is essential and can facilitate identity and development for clients in the bleakest of situations. However, it may be somewhat ambiguous and unfamiliar, especially for counselors who are not familiar with existentialism. Some clients may be more interested in alleviating anxiety or depression. They may not be piqued to explore the deeper questions of life, meaning, or belonging. Existential therapy is compatible with the gospel and then it shows value for human life. It may be considered incompatible and then it has the potential to become nihilistic or stoic for a client who is focusing on meaninglessness. Without the influence of the gospel, existential therapy lacks objectivity, absolute truth, and morals. Like Gestalt therapy, terms can be oversimplified, confused, and difficult to unify in clinical mental health care settings. Existential therapists tend to avoid scientific research on outcomes and may therefore struggle to chart and progress through their own clients' concrete goals. Both existential and Gestalt therapy focus on authenticity of the client. Clients are invited to delve into and appraise their innermost beliefs and then act on what is most important to them. Existential therapy deals with the why questions about the meaning of life and death, while Gestalt deals with the how and what. It is more a philosophy and an approach. Some consider it a group of specific psychotherapies. Gestalt therapy does an excellent job addressing the whole person and environment, the past versus the present, formation, regulation, energy blocking, and especially boundaries. Many clients are stuck in their past, and Gestalt therapy helps them connect with their feelings and be in the present. The client works to confront their cognitive dissonance while focusing on self regulation, self actualization, and independence. If mishandled or untrained, Gestalt techniques can be too intensive for clients. A Gestalt therapist may fail to address a client's future goals, which can negatively affect their motivation. If a therapist focuses too much on feelings, she may fail to deal with rational thinking and behavior. Clients with more collaborative or collective cultures may not value this individualistic approach. It is compatible with Christianity and that it deals with taking responsibility for oneself, confronting one's self deception, and living in and being grateful for the present. It may be considered incompatible in that there is an overemphasis on how one feels and fixating on the present. This would negate principles like hope, faith, action, works, Christian ethic, and moral absolutes. With an emphasis on the present, it may be difficult to see or take time to chart a client's future growth or goals. Some Gestalt terms are borrowed from existentialism and may be conflated or cumbersome to chart, understand, or share. Empirical data suggests that the empty chair technique is effective for specific disorders, but it may not be useful for all disorders. Gestalt is a systematic and interventional version of existential therapy. Gestalt therapy deals with the how and why, as we were speaking of earlier. Ton reminds us that through boundaries, the Gestalt therapist therefore helps the client to have constructive and authentic contact with people and with the environment without the client losing a sense of self, so that the client does not be confused with others or the environment.